Obstetrics and Gynecology at the New York University Grossman School of Medicine, and this is another in our continuing series of reducing the confusion in gynecology. And what I wanted to talk to you about today is to reduce some of the misconceptions and confusion about menopause. In the first place, I think even the terminology is confusing to some people. Premenopause, perimenopause, menopause, postmenopause. Let's see if we can simplify this for you. Menopause is defined as when there is no more ovarian function. Your ovaries no longer make estrogen, they no longer ovulate. That's menopause. Premenopause means you are still making ovarian estrogen. You may or may not be ovulating on a regular basis, but you are making estrogen. Perimenopause technically is the first break in cyclicity. In other words, in the reproductive years, most women have very regular cycles, and then as you're coming off of the reproductive years in the perimenopause, these cycles can become somewhat irregular. You see, to most patients, all the blood that comes out of their vagina is their period, but to me, a menses is a bleed that's preceded 2 weeks before by ovulation. And so if you don't ovulate, you can still bleed, and those cycles we refer to as anovulatory, and from the Greek without. They're making estrogen, but not with any progesterone. And so the perimenopause is a time of fluctuating levels of estrogen, often without ovulation, without progesterone, can cause some real havoc in the bleeding pattern, can also cause some real havoc in what we call the psychosocial symptoms, worsening PMS, free-floating anxiety, mood swings, inability to concentrate, sleep disturbances, brain fog. A lot of these things can be due to fluctuating levels of unopposed estrogen rather than the absent estrogen in menopause. Now, by the time most women have what we call vasomotor symptoms, that's hot flashes and night sweats, they kind of understand what's going on. And that can happen in the perimenopause, not always from the absence of estrogen, but from the delta or the change, the precipitous drop in estrogen, although if you looked at it in the blood, it might still look like it was in a premenopausal range. So when the ovaries stop making estrogen, that is defined as menopause, and some people like to use 12 months of no estrogen production and 12 months of no period as the definition of menopause, but that's somewhat arbitrary. We can do blood work to measure estrogen in the blood and a thing called FSH, or follicle stimulating hormone, because the pituitary puts out this FSH, which gets the ovary to respond. So in a premenopausal patient, estrogen goes up and it feeds back and FSH goes down. In menopause, the ovary is incapable of responding, so FSH is very high and estrogen is very low. But when you do a blood test on somebody, that's just a snapshot of activity on that day. And so sometimes both of those labs will point towards a menopausal range. I don't tell those women they're menopausal. I say your blood work was in a menopausal range, because sometimes there'll be a sputtering or a resumption of a little bit of ovarian function several months later, and the patient may get a spontaneous bleed. So that's why some people like to use 12 months. But if people are overly symptomatic, we don't necessarily wait 12 months to treat them. Once you are menopausal, you can use the phrase postmenopause if you want, but you are menopausal, there's no more ovarian function, and that's going to be forever. It doesn't resume, it doesn't come back if it's true menopause. Now, in menopause, the most common symptom, and relatively early on, are these hot flashes and night sweats. Also, people report sleep disturbances, they report joint pains, they start to put on weight, mostly in the middle, that old midriff bulge, because estrogen promotes lean body mass. A much later sign of menopause can be atrophy or dryness in the vagina, which can make intimacy or sexual intercourse very painful and difficult. In addition, estrogen is a very good bone drug. It helps inhibit the taking away of bone, which is a dynamic process your entire life. So when you lose the estrogen in menopause, women will lose bone. And bone health has become a huge, important topic as women are living longer and longer and longer. In fact, survival on stage 1 breast cancer for 5 years, survival is 99%. Yet in this country, if a woman breaks her hip, 21% are dead within a year, and 25% don't live independently again. Now, yes, they tend to be older, but as people are living much longer and much better quality of life, bone health becomes extremely important. And I'm trying to get my patients as interested in their bone health as their breast health. So the good news is that for the majority of women, by 4 to 7 years into the menopause, those typical symptoms of hot flashes and night sweats often tend to ameliorate and become minimal or absent. Although for many women, 20%, 25%, these symptoms can continue indefinitely. And especially the sleep disruption. If women are waking up 2 or 3 times at night in a pool of sweat, you're not going to be very productive the following day. So this is a really important aspect of this as well. There's been a lot of myths about the pros and cons of hormone replacement. I think that the pendulum overshot the mark after the news from the Women's Health Initiative in 2002 scared a lot of women. 50% stopped taking hormones the next day, 25% went back on. The most common reason for going back on was hot flashes and night sweats. The second most common reason for going back on were joint pains. And so now I think we have learned a lot more about treating hot flashes and night sweats. We've learned a lot more about how to more safely administer hormone therapy to patients. We've learned how to give it if we need to just the vagina for those who may have difficulties with sexual intimacy. So there are a lot of things I think that you could learn about this, and I would be happy to be someone who would help guide you through this. As always, if you have any more issues, any more questions, please feel free to contact us. Thank you.